started, but I just wanted to take a moment to remind everyone to please mute their microphones. And if you are showing your camera, the cameras do take up a lot of bandwidth for people who have trouble with internet streaming. So if you wouldn't mind also silencing your camera, that would be very helpful to ensure that everyone can see and hear everything that we share today. Thank you. We'll get started in a few more minutes. Okay, good morning, everyone. This is Robin Fergus from HR. Thank you for joining us this morning. Looks like we still have a few people coming in here at 9 a.m., so I'll give them another few moments. As a reminder, please mute your camera as well as your microphone. We can hear some background noise. And if you can keep your camera and microphone on silent for the duration of the presentation, that will help those who have difficulty with internet streaming. It takes additional bandwidth for those cameras. So please keep those silenced. All right, we're going to go ahead and get started. We have a very full agenda, so we're going to be moving through the topics very quickly this morning. First, I just want to say I hope everyone's doing well and you and your families are staying healthy. And if you're anything like me, you may be climbing the walls a little bit at home at this point. We've been home for a few weeks now, and I'm anxious to get back to normal life. Last night, I had a really kind of moment of gratitude and a bright spot. I live just outside of Denver, just on the perimeter of downtown Denver, and I took my dogs for a walk last night, and I heard all the cheering and clapping and hooting and hollering for the healthcare workers, and that kind of sent chills down my spine. It was really a powerful moment to hear that, and it was reverberating throughout Denver last night. So that was really special, and it reminded me of just how grateful I am for all of the blessings that I do have, and grateful for everyone that I work with, all of you included. I appreciate everything that you are all doing to keep the university moving forward during this crisis. So please know that we see you, we hear you, and we thank you for everything that you're doing. Our agenda today, as you can see, we have a lot of big topics. Wanted to go through the W-4 update. There were some changes by the IRS made in January, and Kaylee, McKenna, our payroll manager, is going to walk us through those updates. Our benefits team has some very important information about state classified open enrollment. They've made some quick alterations to help us in this virtual environment, and they'll be sharing those updates with us. We also are working, believe it or not, if I could please ask everyone to mute the microphone and camera, just as a quick reminder, I'm hearing some feedback. We are forging forward during this time of pandemic with a retirement comparative analysis, and Terry's going to give us an update on that project. And then we're going to get into some information about the corona pandemic and update you on performance reviews, as well as the new act that was passed by Congress, Families First Corona Relief Act, which you might also start hearing as Family First for short. So with that, I'm going to turn it over to Kaylee, and she is going to share some information about the W-4. Take it away, Kaylee.
Hey, Robin, this is Terry. Kaylee's
Hi, Terry.
actually not presenting today. It's going to be Jacqueline, and she's representing her role as our payroll tax accountant. So thanks, Jacqueline, for jumping in for us today.
Yes, thank you, Jacqueline.
Can you hear me? Okay, great. Good morning, everyone. So we just wanted to give you, hang on, let me mute something else. Sorry about that. We just wanted to give everyone an update on the W-4s. As Robin said, they were updated by the federal government at the 1st of January. And so they're a little bit different than what we're used to. And they're very involved. So I'm sure a lot of people are having a lot of questions about this when they finally go in and look at them, but we did want to give you an overview. So if you look at the screen, it's kind of hard to see for everyone, I'm sure. The new W-4 is on the right-hand side as you're facing it. The first section is still the same. You're still filling in name, address, social security number like usual. You're still choosing your filing status. The new thing here is that there is a new option for head of household. So you have single and married jointly together, or married filing separately together, married filing jointly as another option, and head of household is a new option. Then step 2 is a new feature on this, where for people that have multiple jobs or multiple income families, this section, you can either go to the IRS online withholding estimator and figure out what your tax withholding should be, or you can check the little box and the IRS will automatically figure that of where you're supposed to be for 2 incomes. Step 3 is for what we used to use allowances for, where you said I have 4 people in the family or 5, whatever you were filling out. They've broken that out so it's more like when you fill out your tax return of how many children are under a certain age. So you're going to get credits, whether you have other income credits, and that's where your credits go in. Then step 4, oops, sorry, Eric, we went a little too fast. We're still on the other one. Step 4 is where if you want something extra withheld, you would put this number in. And this is only for federal. This is not affecting your state withholding at all, or the extra withholding. And this is going to come out every time that you're paid. So if you want an extra $50 to come out, you would put $50 in the step 4, and it's only going to come out on federal, and it's going to come out every single time you're paid. So step 5 is still the same. You have to sign it. Now go to the next slide, Eric. Thank you. So anyone who has to fill out this new form is anyone who wants to make a change for 2020. So new employees that are starting this year will have to use this form. Anyone who's claiming exempt will have to use this form. And that's claiming exempt in 2020, not 2019. Sorry about that. Our internationals, non-resident alien employees that have tax treaty benefits will also have to fill out this form. And as I said, anyone making any changes will have to fill out this form. Those of us that are current, that don't have to make any changes, don't want to change anything for 2020, do not have to fill out a new form. And all of these forms are to be completed through employee self-service. If anyone has any questions, if any of your employees have any questions, the best resource is either going to be the IRS website. They have a wonderful calculator on there. You put in some estimated amounts for the year, and it'll tell you exactly how much you need to have withheld. They also enhanced it recently so that if you want a refund, you can put in the amount of refund, and it will also tell you what you need to have withheld. Other than that, we suggest that they go to their tax advisor, as no one here at CSU is allowed to give tax advice.
Jacqueline, this is Kathy moderating the meeting, and we have a question in the chat. One
Okay.
individual is asking, is there a way for extra to be withheld for state tax?
For state tax, we ask that Colorado follows the federal W-4, which means they use the same form. Colorado has not updated their site yet for the deductions part very well. So we're still kind of waiting for that. I'm sure that the current situation has put that on the back burner. But if you want more withheld, you would have to fill out the federal W-4 and go to that step 4, put in the amount you want in there, and then write for state only on the W-4 and send it into HR payroll.
Thank you.
Thank you.
Great. Okay. Sounds like we can advance to our next topic. Is that right, Jacqueline? Are you
Yes,
open
thank you.
enrollment? Okay. So over to our benefits team. Terry?
Hello, everyone, and good morning to you. So we're super excited that state classified open enrollment is just about ready to begin. The start of the open enrollment period will be on April 14th, and it will continue through May 18th. Now, many of you as our HR professionals across campus are probably also very familiar that the state of Colorado offers something called the medical insurance supplement. And that medical supplement period will also be running alongside the open enrollment period. Now, it does last just a little bit longer because employees that have children that are considered lower income under the state's rules may qualify for the subsidy from that plan. There is documentation that needs to be uploaded into the state system. So with that, there's some super exciting changes again that are happening this coming July 1st, which is when the benefits become effective with the state of Colorado. They've actually switched their key administrator from United Healthcare to Cigna. Kaiser Permanente still does exist in the mix. Now, the really exciting thing is they've done almost what I would consider a complete overhaul of their medical plan options. So instead of the 4 plans that they used to offer, they've now broadened that, changed the plan design, and levelized 3 plans with Kaiser and 3 plans with Cigna. And of course, the details of all of those plans, you can go to our website. And Brittany has made a beautiful banner for open enrollment. It's on the right-hand side. Just click on that and it'll take you into all of the information and then also link you to the state of Colorado. Another key factor is the premiums have been reduced on all of the plans. Now, one thing to point out that may have led into the decision of the state to be able to reduce those premiums is it looks like for the first time they're instituting a tobacco subsidy. And what that means is that it's basically if you use nicotine, or tobacco, there will be a surcharge. So you will be subsidizing the plan at a bit higher level. As you're completing your enrollment, you will have to attest to your tobacco status. Another really cool thing is, again, first time, state's never done this before. They're making a new vision plan. That vision plan will be administered through iMed. So another advantage for people that wear glasses or contacts to have a standalone plan that they can receive a higher level of benefits from. Paladina Health is a freestanding provider that does provide some care services. Cigna members are eligible for that benefit. Again, more information about that on the website. Expanded telemedicine options. Again, during COVID-19, we're sure hearing a lot about using telemedicine. And one of the neat things the state has done is they've changed their cost sharing model for how that will transpire in July. It will now be free. There will be no cost sharing if you're a Cigna member and choose to utilize that service. And there will be a very low copay for Kaiser. And then again, just a reminder, please hop on our website and you can see all of the information. Excuse me. One thing I did want to mention is it is a mandatory open enrollment, as you see in the orange banner up on the top. Certainly that's a little bit concerning to all of us since we're in a remote work mode at CSU currently. We have heard that the state of Colorado may be having a phone line open with Benefit Solver, who again, as you can see in the image on the right, is the provider of the open enrollment system for the state of Colorado. More information to come. There is a call this afternoon with the state benefits office, and we're hoping to ask them if they're going to be making that available and what that phone number will be. We are a little concerned about our labor, trades, and crafts individuals who may not have access to a desktop computer. They may have to use a mobile device. If they do not have a mobile device, we just want to make sure there is another option for them to be able to enroll. And with that, Kathy, are there any questions about open enrollment?
I'm not seeing any questions on the chat at this time. Thank you.
Thank you, Kathy. All righty. Eric, if you wouldn't mind advancing to the retirement comparative analysis. Perfect. Thank you, Eric. So as you can see on this slide, we are really we're just so tickled, if you will, that we're able to kick off this new project. And this new project for spring 2020 is an implementation of a research-based approach to looking at improving our retirement preparedness for all of our university employees. Well, the main premise of the retirement project is on our defined contribution plan. So that's primarily going to affect our faculty and administrative professionals. So basically those that are considered non-classified staff at CSU. We are going to bring into this project, though, looking at our University 403B, which all employees are eligible to participate in, including the state classified employment category. And then many of you are familiar that there is a student employee retirement plan referred to as the CERT plan that students are required to contribute to in lieu of Social Security. And that plan is actually driven by their class enrollment. We have partnered through a request for proposal with a company based out of Denver. They are a national firm and their name is Innovest Portfolio Solutions. We have also comprised an ad hoc project committee that is made up of individuals across campus that follows our shared governance model. So in addition to Robin and I being key stakeholders from a human resources perspective, since the retirement plan administration daily that occurs is delegated to us in human resources, we also have partnered with faculty council, and we do have a representative from that council, also APC council. We also have a representative from our University Benefits Committee. And then we have another ad hoc committee that supports HR in a triennial or every 3 year, I should say, process where we do review under state statute our DCP plan with other universities in Colorado. So we have representation from that committee as well. So really excited, again, to be able to partner and to move forward on this project. Now the phases that you see below are actually a 54-week minimum journey. The phase 1 will be benchmarking and strategic planning. Phase 2 will be a retirement vendor search, which basically is a request for proposal. So many of you are familiar that the vendors currently that we are contracted with are Fidelity Investments, TIAA, and AIG, which is formerly known as VALIC. So again, what will happen is there will be a full service request for proposal that will occur for the committee to then review all of the respondents to figure out how the university will move forward for retirement plan administration, and also looking at investments that will be available under the umbrella of those 3 plans. Phase 3, very important, conversion, coordination, investment selection, and also the record keeper selection certainly is paramount. Now, you may see the imagery on the right. We're kind of branding everything we're doing with this retirement analysis project so that you'll be able to tie that imagery to following us for 54 weeks. There will certainly be an opportunity for employees to share their voice. During one of the phases, we will actually be doing a survey to employees to make sure that we are hearing what else do they wish for us to contemplate and to consider as a project committee as we move forward. So if you go to our Human Resources website, again, you'll see that imagery. If you link in, you'll see that Brittany has created a dedicated website for the project. So we've initially started with some frequently asked questions. And then as you can see below, we have 3 online forums that Robin and I will be posting. This Friday is the first one. We will be recording and we will post one of those recordings on our website at the conclusion, which will be wonderful too. And with that, that's everything I have to share about the retirement project. Robin, did you want to add anything?
Thank you, Terry. This is a large undertaking, and as you said, the project will go on for over a year, and we have many stakeholders, and I really appreciate your leadership on this project, your depth of knowledge, and your willingness to charge forward with this. This is a really important project for the university and for all of us to make sure that we have the best options available and the most, I think, fiscally responsible pricing models that we can possibly have for our employees to maximize the retirement savings. So thank you.
Thank you very much, Robin.
Yes.
Kathy, do we want to defer to Kathy to see if there's any questions?
Yes, I actually just wanted to remind everyone to please turn their cameras off. Some individuals are having trouble with the streaming, and that takes a lot of bandwidth. So please keep your microphones and your cameras muted so that we can ensure everyone can hear the presentation and see the screens. Thank you. And sorry, you were going to ask Kathy if we have any questions.
Yes, that would be great.
Sure. Thank you for the reminder, Robin, with the screens and the microphones. There is one comment on the chat that says it would be great if we could get help with trusts and wills too. But no questions, just a comment.
So actually, I don't know if I have any of the benefits team that are online with us today too. So please do correct me if I misstate anything. I do believe that there is a feature through our CompPsych EAP benefit where you can receive assistance with having a will created through a referral service. I also do believe perhaps through the state classified benefit plan through the life insurance carrier that there is an opportunity with them. Jackie, do you happen to be online? Could you confirm that?
Yeah, that is correct. So both the state classified and the AP plans both offer assistance with at least a simple will on the life insurance carriers.
Oh, thank you so much, Jackie, for clarifying. And then also I know for the estate planning, we usually have our annual Fit Life event, which is our Fit Life Health and Financial Wellness event. Unfortunately, this year, COVID-19 canceled all of those sessions that we had planned. Every year we do offer an estate planning session, which is hosted by one of the retirement vendors, and it's very thorough. So that is always an option for the future. Anything else, Kathy?
Yes, thank you, Terry. There is one question. Will any of the current options be removed?
You know, certainly that's a great question. That would be jumping to week 55, and that would be the outcome of the project, as in we don't know what the outcome of the project will be. So I just want to make sure that everyone knows that the body of work that the university, our project, and Innovest will be embarking upon, we don't have a derived outcome. That outcome will be derived after going through all 3 phases. Now, we can share with you that other universities in the state of Colorado have also completed this same project, and different institutions have had different outcomes in how they approach the project and how they also approach making decisions at the end of the project. So again, I think it's very important for both Robin and I just to be clear that we do not have a perceived outcome that outcome will be derived again by the project itself. So again, I don't even know what'll happen. It'll be exciting, it'll be a journey, and we just know that it's time to look at our retirement plan, and more importantly, make sure the value of our benefits that we afford through retirement are at a stellar level for all of our employees to feel as if when they're ready to retire, they are well set to embark upon that new journey.
Thank you, Terry. Really appreciate all of your work again on this project. I think we are going to move forward. We have quite a bit of information to cover on COVID-related information, and it doesn't look like we have any other comparative retirement project questions in the chat. Eric, are you going to be sharing updates on this portion?
Yes, I will. Thank you, Robin. And this will be really fast for everyone. Their performance reviews, y'all may have heard, have been pushed back, at least given the opportunity for supervisors to complete them to June 30th. So the previous April 30th date is now June 30th. And people can complete them before June 30th. I'm just realizing that they have until that time. So we just want to get that out there to everyone again, in case y'all are getting questions from the supervisors in your work groups. So I'm just can remind them that June 30th is the date, and yes, they can complete them before that.
Great. Thank you for that update. And there is information on the HR FAQs regarding this topic as well, as a reminder. So we're going to move into COVID, the Families First Corona Relief Act, for an update on that new law and how we are planning to implement it here at CSU.
Good morning, this is Tracy Hutton. Just a quick overview of the act. As we indicated, Family First Coronavirus Relief Act, often called Families First or FFCRA, was signed into law on March 18th and became effective April 1st. The law will sunset December 31st of this year. There are two components to the law that we wanted to discuss today. One is the expansion of family medical leave, known as the Emergency Family Medical Leave Expansion Act. It establishes a new FML qualifying reason, which is the closure of school or childcare facility. It's not an additional 12 weeks. It is combined with other family medical leave that an employee may take. Under the law, it provides paid leave at 2/3 of the normal rate with a $200 a day cap. CSU is moving forward with no prorating and no cap. Another significant change for this family medical leave qualifying reason is you only have to have 30 days of employment versus a full year, which is for all other FML qualifying reasons. So anyone who's been an employee for 30 days would qualify for this reason under FML. The second is the Emergency Paid Sick Leave Act, and it establishes paid sick leave for 6 qualifying COVID-19 reasons, provides 80 hours of paid leave for full-time. That's prorated for part-time employees. The 6 qualifying reasons roughly kind of fall into 3 are about care for yourself and 3 are about care for others, including the school closure or closure of a child care facility. The act allows but doesn't require the use of intermittent leave. This was just determined yesterday. CSU is going to allow intermittent leave in half-day or 4-hour increments. So to allow some flexibility for folks, we will allow a half-day working and half-day leave, so to speak. Can you advance? Thank you. So this is a quick little chart overview of the requirements of the law. You can see those top 3 in green under the emergency paid sick leave. Those are sort of the caring for yourself. So that's if an employee is subject to a quarantine or isolation order on the advice from a healthcare provider, self-quarantine, or experiencing symptoms. So you can see all of those And at CSU, that final column, how we're implementing it, a full pay with no cap for those 80 hours. The second three in that blue area, those are the ones that are about caring for others. The first one, caring for an individual subject to a quarantine or isolation, or someone who's been advised to self-quarantine. So someone who's experiencing symptoms of COVID-19. And then number 5 is the new one, caring for your own child whose school or place of care has closed or whose care provider is unavailable due to COVID-19. Number 6, experiencing other substantially similar condition. We call this the bucket, the catch-all bucket. We're not sure exactly what will fall into that, but learning as we go. The law just went into effect, like we said, a week ago today, so still getting more information. And you can see that under each of these, under the law, the rate was capped at $200 a day and 2/3 of the regular rate of pay for 80 hours. CSU, again, is going to pay an employee's full pay with no cap. The final one, the FML expansion, is up to 12 weeks for the reason established as their minor child school or child care services closed due to a COVID-19 emergency. Now, under FML, the first 2 weeks are unpaid, but obviously most folks could substitute that emergency paid sick leave under number 5 for those first 2 weeks, resulting in that full 12 weeks of pay. Again, this was under the law at 2/3 and $200 a day for 12 weeks. CSU is going to not implement those caps or prorating of the pay. Again, just to note, this is not an additional 12 weeks. So if an employee has already used some portion of their family medical leave allotment for the 12-month period, they would not necessarily qualify for the full 12 weeks. I think it's important, right, for folks to know that if, for instance, you have someone who's maybe having is expecting a child later in the year, may want to take some time so that they're informed that this is FML and would count against future entitlements in the next 12 months. Can you advance for me? So there are a couple sort of administrative pieces with this. The Department of Labor is requiring a posting. We will have that posted on the HR website. In our office, we will distribute it. We have distributed it to a lot of HR folks, and we're asking that if you have someone who has access to a building to print this and post it so that employees will see it. Additionally, there are 3 new forms. One is a request for leave. So if you have an employee who you know would qualify for this and wants to take the time, we ask that they complete this leave form. And then there are 2 employee self-certification forms. One is for reasons not a child care, and then one is the child care or school closure. We will post those on the HR website. You know, the employee will submit it to the supervisor and go through HR with the normal FML process. I think we have some screenshots of those forms, but again, they will be put up on the HR website. Can you advance the screen for me? So you can see that in the middle there is the leave request form. Hard to see what it says, but it asks what reason they're taking the leave. And then on the left is the emergency paid sick leave, and on the right is the school or child care closure. So we're asking folks to certify, right, that these are the reasons that I'm requesting that leave. I think that's it for me. I'm going to mute myself. Don't you all wish we could do that more often?
Hi, Tracy. This is Kathy. We have a few questions in the chat if we have a moment. First question, just to clarify, if they are able to work remotely but may have, oh, now it scrolled up, just a moment. If they're able to work remotely but may have these situations, they should not use this, or if they're unable to work, or only if they're unable to work?
I think that, you know, if they want to take this, they can use this. Yes, it is first and foremost, we want people to work remotely, but they will have to certify that they're not able to work or telework. So that's a requirement on the form. And people may have been doing that and now say, I really need to take care of my kids. I'm trying to homeschool and get my job done and I'm not accomplishing either. Then they have the right to take this leave.
Okay, and next, is any communication going out beyond HR department people?
Yes, we will be sending more information out.
So I can also add, not only will it be posted on the sites that Tracy's already mentioned, that the COVID site and our HR site, but yesterday a presentation was delivered to the executive leadership team, and today we have a presentation with the Council of Deans to share an update.
Okay, next question. How would the FML expansion apply to someone just coming back from 12 weeks FML April 15th? Does the 12 weeks start fresh April 1st over, or does the recent leave taken carry forward through April 1st?
So you would look at what is their leave year, right? So if they took FML, say, starting January 1st through the end of March, then if they're faculty AP, right, it's a look forward. So it would go through the whole year and they wouldn't be eligible for this. Now they would be eligible for the 2 weeks of emergency paid sick leave because that is not FML. You don't have to qualify for that, but they wouldn't be eligible for the 12 weeks.
Thank you. Next question, are the forms in Spanish? What documentation is needed? I guess that's 2 questions.
We are going to try to get them translated. We don't currently have them. You know, like I said, this went into effect a week ago, so we've been moving pretty fast and furious to get things developed. So we don't have them currently in Spanish, but that is on the horizon, we hope. And Kath, the second part of that, will you tell me? I'm sorry.
Sure. What documentation is needed? I suppose beyond the forms themselves.
I mean, it's going to vary, right? There isn't necessarily additional documentation on the forms, the certification. It'll ask you, the name of child, the child care facility or school that was closed. Is there any information? You'll have to certify that you're unable, to work or telework. So it really is going to depend. We ask if you're asked to quarantine, provide us information about, right? A healthcare provider asked that, or we traveled from a country that I know I have to do that. So that information is on the form. So we're hoping, they can provide additional information. You can attach a statement from a physician, et cetera, but we're hoping that the forms will ask for the pertinent information.
All right, and the next question, if unable to work remotely, should this replace admin leave pandemic?
No, it should not. That's a different, right? That is not about these reasons. Admin leave pandemic is we don't have work or they're not able to work remotely. These are for these very specific reasons that the leave would you have to qualify under those specific reasons.
All right, and then another question, like FML, is a notification and designation notice required?
These forms will replace that.
Okay, and for summer, does this apply if the school would have been closed anyway?
Well, we don't know. They'll have to certify. For instance, we don't, there's a lot of, my crystal ball is broken, gosh darn it. So we don't know if there will be childcare facilities available for employees in the summer. If this continues and those aren't open either, they may be able to use it. So it really will depend upon the circumstances.
Okay, and also, can the FML be backdated?
To April 1st, that's when the law went into effect. So it can only be from April 1st on. Any of the leagues can only be from April 1st on.
And also, is the DOL poster available online?
Yes, it is. The link that's in this presentation that we have sent out to a lot of HR folks does link directly to the Department of Labor's site online.
All right, I think that is all the questions for this moment. Thank you.
Thanks, Kat.
Great job, Tracy. think, Nick, if you're on, was to talk about these job codes and how the system work. I know Nick and his team have done a really good job of creating these items in Time Clock Plus for us to be able to track some of this stuff. So, Nick?
Yeah, hi. Hello, everybody. So the admin leave pandemic job code, we're going to keep using that, but its usage is being expanded. So if you looked at it before, there were no projects under this admin leave pandemic job code. That's going to be changing here. It hasn't been deployed yet because we're going to be sending out communication to everybody about how this is going to work. And at that time, I'm going to be adding these 3 projects. So when you create one of these entries for admin leave pandemic in Time Clock Plus, it's going to require one of these 3 projects. And these correspond to what Tracy was just talking about. So insufficient work from home is the same thing as what admin leave pandemic was prior to April 1st, right? It's just we don't have enough work from you. That should be entered. Then the other 2 correspond to the new legislation. So emergency paid sick leave, that's for COVID-19 related illness, and childcare FML, which is what Tracy was just talking about as well. So you choose the admin leave pandemic job code, put in the sum of hours for the whole pay period, and choose the correct project code for that. Of course, there can be multiples of these used. So if part of the time for the pay period should be insufficient work from home, but then some of it they had work that they could do from home, but they were on emergency paid sick leave, or they had childcare they had to take care of. You can enter multiples of these and for a single person and have them sum up to however many hours they should have for the pay period. And then as previously with admin leave pandemic for prior to April 1, please enter the assignment number in the note field there. If you don't do that, it's not the end of the world, but it will default to the employee's primary assignment in the system. If you're not sure if the person has multiple assignments and you're not sure if they have multiple assignments, which is the primary, just go ahead and put the assignment number in there anyway. It won't hurt anything. And then, as it says here, it doesn't have to be all admin leave pandemic job code. They can work some, and then they can have some of one kind of this type of leave, or several types of leave in conjunction with hours actually worked. However, that should be appropriately used. And this, excuse me, this job code and all of the projects are going to be available to all employee groups across the university. And I should note, I understand that prior to this, prior to April 1st, we were telling people specifically not to use admin leave pandemic for cases where somebody was sick with COVID-19, for example. So the usage of this code is changing, and we're trying to make that as clear as possible. And I understand that might create some confusion, but we're just rolling with the punches with new legislation. So now this does apply to those sick leave cases, but you pick a project instead of just picking a separate sick or annual leave.
Nick, we have quite a few questions. Would you mind if we paused and answered some of the questions in the chat?
Absolutely.
I'm happy.
And I can see them here. I'm going to start at the bottom. So this is everybody. So student and non-student hourly, yes, this applies to them, correct? Somebody correct me if I'm wrong.
Correct.
And work study students, this applies to them too.
All employees who have worked for the university for more than 30 days.
Correct. One of the questions. So this is something that I don't think was sufficiently communicated, but this is part of this insufficient work from home in particular is to try for the university to have some mechanism of reporting on loss of productivity from COVID-19 in general. And that means that we really are trying to get a handle on everybody who can't work from home right now, including exempt employees who typically don't track time worked, but just track leave. If there are exempt employees who are unable to work from home, we would like that information entered into the system as this insufficient work from home project. That is not going to affect the employee's pay. It's just a mechanism for administration to know, okay, we're paying these people right now, but they're not actually producing anything for us at the moment. Does include AP hourly employees. That average hours report is out there still to help people understand for employees that didn't work a regular schedule, to give people an idea of how much they have worked so far this semester, what they work on average so far this semester, as a guide for departments to know perhaps what to put into the system for those people. If they work part of that average hours but don't work up to their average hours, so they're doing some work from home but don't have sufficient work to complete all of their average hours, please input insufficient work from home for them to get them up to at least their average hours for the semester.
And Nick, can you clarify that that's for students?
It is for students, although we're doing it for our other hourly employees as well, correct?
Correct. Yes.
Okay. But yes, it does include work study and non-work study students.
We also have a question, Nick, about the Act itself, and is school considered K-12? And the answer to that is the Act speaks to caring for minors in your care. So K-12 would cover students up to the age of 18 who would fall under that last category on the beautiful chart that Tracy presented. I don't know if we can flip back to that, Eric. But the leave the provision is for those. In the bottom box, FML expansion applies specifically to a minor child school or child care services. So that is for a child under the age of 18. The next question we have is, what if you have older children living with you that need care due to COVID? And I would direct you to the number 4 of the chart above. That allows for up to 80 hours of paid leave for caring for an individual subject to quarantine or isolation order who has been advised by a healthcare provider to self-quarantine. So the additional provision is for minor children. Caring for others would be limited to paid 80 hours under this act. I'm just going back to the chat to see which questions we've missed. Nick, I know you answered several of these, so I'm trying to filter out which ones we missed. Can we enter one entry per week for a student or non-student hourly to get their average hours instead of entering it as if it's a normal schedule showing multiple entries per week? Nick,
yeah.
I'll defer to you.
Great question. Yes, in fact, you can enter the lump sum of hours for the entire pay period. It can be even less frequently than the week. And the reason for that is that there isn't overtime earned on that job code. And so you can put in, if the person, let's just say the person works an average of 80 hours, a full-time schedule, you can put in 80 hours on the last day of the of the pay period. That's not a problem.
And we have another question, Nick. Monday, the Business Financial Services Group came out with a COVID code that payroll can be moved to. What salary does that apply to?
What salary does it apply to?
Yeah, I'm unclear on the question, Bev. Maybe we could speak to what we know about tracking that BFS is doing.
Yeah, so BFS, and I'm not, forgive me because I don't know exactly what they want this to reflect, but they're trying to get a handle. I think that this has primarily been a research question, but they're trying to get a handle on costs, expenses related to COVID-19, and so they've offered a way in BFS to move, in KFS to move these certain costs to this special code. But I don't have guidance related to that. I'm not sure how that's working in KFS, unfortunately. But nothing, I can say that nothing is automatically going to that from the HR system.
We have another question, Nick, about the tracking. Will the tracking of being paid and not producing anything come back to hurt the employee or a department at a later date? So the university has a desire to track the funding and how individuals are being deployed during this crisis, because we're hoping that there will be some form of relief that comes to the university. As of right now, it is unclear of if any federal relief or state relief will be shared at the university level. The entire state of Colorado is adapting their coding for payroll in order to track the impact on the state. And we're being asked to do the same thing here at CSU so that we can help make a business case to secure some funding relief. Certainly, we also need to know if there isn't work available for people, what is the impact on our payroll? And the financial picture is not 100% clear at this time. We're still sifting through all of the impact of the COVID situation. And our leadership team wants to stay apprised, partially because we need to know how many departments are impacted, what is the impact on the level of service, do we have work available? So a lot of reasons to track this information. I'd say the number one reason is to know if we can ascertain some relief at the end of this.
There's another question here that I don't think we've addressed. That would insufficient work from home also apply if the employee does not have the capability to work remotely? No. If there is work that somebody can be doing from home, but they don't have the capability, obviously if they don't have the capability because of childcare or illness, there are other ways to address that. But if they otherwise, Nick, yes?
I think actually that has been used for that. If we have folks who are not able to do the work from home.
Is that true? Okay, I apologize.
Sorry, no, there's a lot. It's confusing, but if they are not able to work remotely.
Okay.
Jump in, anyone else, if they see it, but that's my understanding. We do want to track that as well.
Using that same project, insufficient work from home?
Yes.
Sorry, I muted myself again. Yes.
Okay. Wendy True is saying, can you explain that again? I assume she's talking about this. So.
Right. If we don't have work for someone to do and they aren't able to do work from home, then this is the code that we would use. Whether it's because we don't have it or they don't have the capability.
this is a little bit of an aside, but since we're coming here to the end of the when departments can create entries for March, I just want to mention, since this is a good group to mention it to, we had a recent update to Time Clock Plus, and Karen and I have been hearing a number of reports that not all leave requests, are appearing on dashboards for supervisors and department HR role. So I would like to put in a plug for people who cannot find their leave requests, or if or to just go out to the request manager under Tools and Time Clock Plus and double check that their requests have actually been completed. We're working with Time Clock Plus to get that resolved, but it seems to be sort of hit or miss, and we haven't seen anything quite that random with that before. So just a quick plug to please check and make sure that all leave requests are approved. Thanks.
This is Kathy again. There's been a few requests for the grad assistant postdoc question. I believe that's for admin leave, pandemic code. Has it been determined how to track grad assistants and postdocs who are not in Time Clock Plus?
Hi, this is Robin again. We are still working through that question. Nick and I are in conversations with several leaders that oversee the student aspects of employment at CSU, and we will provide an update as soon as we have one for you. We are awaiting some direction on that piece, and I'm not sure, Nick, if you would add anything else if you've had another update, and maybe I've missed it.
I haven't had an update to that either. If the decision is made that we need them in Time Clock Plus to track their time, I can get that done in a hurry, but I do need permission to do so.
Yeah, we will follow up and let you know.
One additional Time Clock Plus suggestion or question. Can we get a box to approve this leave as we input it?
Unfortunately, no. And that's a limitation of the system. I know it's not super convenient.
I'm going to move us ahead because we have quite a bit of information still to cover, and we only have 5 minutes left. So wanting to provide an update on the essential in-person workforce here. We have gone through several exercises as a university. Through the senior leadership team, they've collected a list of essential in-person personnel, and that list has been refined at least once, possibly twice at this point in time, to understand who needs to be on campus on a regular, ongoing basis. The list does not include those who need to pop in to pick something up, or a faculty member who needs to drop in to present once in a while. So that list has been refined. We have been having conversations for quite some time about offering a pay differential to critical service personnel. And the reason why the language has changed, I want to make that very clear. A critical service pay differential is not identical to an essential in-person individual. So currently, I believe there is a list due back to the executive leadership team by noon today that will identify, of the essential personnel that have been submitted, who is eligible for critical service pay. The president and her leadership team have identified a model that we will be able to track through Time Clock Plus. Nick has graciously created us another code for us. There's a job code now embedded in the system called Critical Services Pay. And with that entry that's done by either the HR liaison or the supervisor who's entering time for their employee, that will be an indication for our payroll team to check that these individuals are eligible for pay on the lists that are submitted, and an additional hourly amount will be placed into those individuals' checks. President McConnell has approved that this will go back to the start of our virtual campus date, which was March 23rd. So we will be working on getting retroactive payments out as soon as possible. But this will be available starting this biweekly pay period today. Once we have that list of individuals collected back midday, Nick is prepared to send a letter out to campus with the instructions that you've all been hearing about today about the new job codes and project codes related to the Families First Act, as well as information related to the critical services pay. Please know that this is only for those who have been pre-approved on the list that's being collected through the executive team. I will also share that the criteria that we're working with will be for both. The intent of the pay differential is to honor primarily our lower paid individuals. President McConnell and her leadership team feel very strongly that they want to offer a pay increase honoring that they're taking a risk coming to campus. Those individuals such as custodians, people who are in buildings that have high exposure to the public, that are also coming in harm's way. So perhaps could you go back a slide for me, Eric? I think the criteria there was up. These are the categories that have been defined. So healthcare providers, including human, physical, mental, and veterinary providers, security and safety, obviously our first responders, critical lab researchers, critical research operations personnel, collections and cultural spaces that are monitoring and protecting, such as the Anthropology and Art Museum, critical facilities and dining personnel, animal and plant care staff, our construction managers and workers, and those who are providing service on campus. All of this is for on-campus service, so no one who's working from home would be eligible for this type of pay. So our student service and support employees, IT service employees, as well as library service employees and mail services. And sorry, my screen is being cut off, so I cannot see the language at the bottom of the slide. I'm trying to move it. Bear with me. And those who continue to have access to campus, including buildings with permission from their supervisors, and it can include student employees and supervisors providing the students are continuing to work. So the categories that are listed in the first bullet are those critical services categories, and those department leaders have been contacted, and the list will be submitted, as I said, today. Eric or
Can I jump in on something?
please.
Related to this new code, this is going to be in the instructions that will be sent out, but I just want to mention, I see a question in the chat about what if somebody is working some on campus and some at home. The code that's in the system is to allow departments to track when those folks are working in that capacity, that critical capacity where they are putting themselves at risk. So you will record only the hours that should get that bump. So the employee should track their time as normal, and then this code that's in Time Clock Plus will be the additional pay only for those hours that are deemed appropriate, if that makes sense. So if you just put in this critical services hours, it won't pay them their normal time. It's just for that additional pay, however that's determined by the president's office.
Robin, I also think that, right, that list is essential services, which is different than critical services. So that's what's being it's being narrowed, right, from all of those folks to those critical services eligible employees. And that's what is being asked now, to provide information related to which of the essential in-person personnel actually meet the criteria of critical services. Is that your understanding as well?
Yes, I apologize. I didn't make that distinction. So there is an exercise of culling the list that I just read through that's currently posted on your screen.
And I see Renee has asked a question about IT support staff. There is a mention of on-campus IT support in that list.
So that is one of the essential services. However, the exercise that I didn't explain very clearly is that we're culling that list down from those individuals that have been deemed essential. Who is eligible for pay is the exercise that's occurring today with our leadership team. So those who are directly in risk on a regular basis, being put in harm's way with contact with the public. For example, a custodian who is in and out of buildings, we don't know what surfaces have been touched, how areas have been utilized, and what type of traffic that those areas have been subject to. So they're putting themselves in harm's way on a regular basis, versus I may be an IT professional, but I'm coming in to check the server and maybe leaving, as one example. So that list is being culled down, as I said. Great. Do we have any other questions in the chat? We're over time, and I want to be respectful of everyone's time. I appreciate that we have shared a lot of information today, and we're asking a lot of all of you, as well as your supervisors, with regard to making adjustments to entering time, and appreciate everything you're doing. Please don't hesitate to ask if you do have questions. We understand this is a lot to navigate. This is a lot of change, and we're all navigating this space for the first time. So please ask a question if you have a concern. Doesn't look like we have any new questions, Kathy.
There's been a lot, and I'm trying to catch up. I do see, can we provide additional compensation for our IT staff that are required to come in and work in close proximity? They cannot social distance at work, but are essential to continue online course production.
So I'm going to just direct those questions back to the process that's already taking place with your leaders. We will, in HR, will not have the final approval of that list. That's going through the president's office. So I would suggest reaching out to your senior leaders in your organization, and presumably they'll be submitting who they believe meets the criteria today. A set of criteria were sent out. So unfortunately, I can't answer those questions because it's not in our control.
Also, how soon will this recording be available on the website? I know I'm recording it, and we'll technically give it to Nick, and we'll try and get it up soon.
Do we have any other questions, Kathy?
When will the codes be available in Time Clock Plus?
I can get those in there. I was waiting until we got information out, but I can get those up there today.
Anything else? Apologies that we've gone over our time. Appreciate everyone who was able to stay and listen and all the great questions. Thank you again. And please know that we appreciate everything you're doing to support the university. Have a good day. Thank you.